Okay, looks like it's time to get started. I just wanted to point out really quickly before we start, we do have some poll questions up and we would encourage everyone to participate in those. We'll be getting to that in a few minutes after Lenny gets started, but this is partly just he wanted to have some background on where you all are coming from so that he could appropriately address what you might need most from this topic. So with that, I'll get started. Please, we would love to welcome you all to the American Indian and Alaska Native Mental Health webinar series. I'm Kate Trams, and today we have Lenny Hayes here to present on a silent epidemic, sexual violence against men and boys. We would like to take a moment to acknowledge the difficulty of this topic, and we want to encourage listeners to keep self-care in mind when deciding to participate in this. And I'll just note too, all of the poll questions are anonymous. If you have a comment that you wanted to make, the open-ended question, the anonymous comments, thoughts or experiences is the best place to do that anonymously. We also have a chat pod where you can make comments, and but it will show the name that you used when you logged in. So just know that that is not an anonymous spot to share your thoughts. This training series is brought to you by the National American Indian and Alaska Native Mental Health Technology Transfer Center. We are part of the MHTTC network, which also includes 10 regional centers and a network coordinating office, as well as the National Hispanic and Latino MHTTC. This project is supported by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and the content is developed by the presenter, and the opinions expressed do not necessarily reflect the views or the policies of SAMHSA, HHS, or the American Indian and Alaska Native MHTTC. In the next couple of days, we will send out a follow-up email to everyone who attended, which includes a link to the recording, handouts of the slides, and a CEU request form. Our center is a NADEC certified educational provider, and we'd be happy to provide you with CEUs for a $15 fee. We want to make everyone aware that our current certification is through NADEC, which is a addiction counseling certifying body, and we just wanted to note that we are working on additional certifications, but that's what we have available at the moment, and you should always check with your certifying body to make sure that they accept CEUs from these specific providers that we have. Immediately following today's webinar, you will be redirected to our GIPRA evaluation. This survey takes just a few minutes to complete and asks about your satisfaction with the event. This feedback is critical to our future work, and we value your opinion and would greatly appreciate your time in sharing your thoughts with us. You will be muted for the duration of this webinar, so please use the chat pod and the poll questions as well to share your questions and comments, and we will address questions at appropriate points during the presentation. Our speaker today is Lenny Hayes. Lenny is a citizen of the Sisseton-Wahpeton Oyate of the northeast corner of South Dakota, and he is the owner of Tate Topa Consulting and has been in private practice in marriage and family therapy. His training includes mental and chemical health issues that impact Native communities, and he's focused a large part of his work on how these issues impact Native LGBTQ and Two-Spirit individuals in particular. He speaks regularly on historical and intergenerational trauma, child welfare, and violence in all forms, but especially the little discussed topic of sexual violence against men and boys. I'm so grateful to have Lenny here today with us, and he's a wonderful teacher and thoughtful presenter on this topic. So with that, I want to welcome you, Lenny, and I am going to pull up your slides here a moment. Oh, let me get you back to the beginning, and I'll pass things over to you. Thank you so much, Lenny.
Thank you. Good afternoon, everyone. My name is Lenny Hayes. And as a Native person, we always introduce ourselves and who we are. Again, I'm from the Sisseton-Wahpeton Oyate of the northeast corner of South Dakota. I am founder and owner of Tate Toba Consulting. I am in private practice and I specialize in marriage family therapy. I am also a chemical health therapist. I'm an advocate, a mentor, an educator, and a motivational speaker. In my language, I am identified as a Dakota Two-Spirit male. In my language, I would be referred to as a Winkta. I am a survivor of child sexual and physical and mental abuse, and I'm also a survivor of the foster care system. So, as Kate had said earlier, what we wanted you all to do is to take part in a couple polling questions that I think is really important, because as I have traveled the country presenting on this topic, one of the first questions I ask is, how many of you know of a male, boy or adult, who has been impacted by sexual violence? How did you respond? What were some of your struggles and challenges? So let's take a look at some of the responses. We're looking at the first one. And it looks like 14 individuals responded by saying yes, they know of. The second polling question, how did you respond? There was a response to, I listened, which is a really good thing. Because often, sometimes when we don't listen, we always jump to that mode of wanting to try to fix it. What were some of your struggles and challenges? 36% said, I didn't know how to help them and what to say. All right. Thank you all for participating in this poll question. So, due to the nature of this topic, I really want to acknowledge everyone and let everyone know that we're going to be talking about some heavy stuff, so I really, really want you to take care of yourself. If you need to just step away for a few minutes, please do. I really encourage that. So first of all, we're going to talk about sexual violence. And because I have so much information, I'm not going to spend a lot of time on each slide, because I believe we only have an hour for this webinar. So what is sexual violence? When a person uses tricks, power, threats, or violence to have sexual contact with another adult, that is called rape or sexual assault. Incest is when the individual is a victim of a relative, and child molestation is when a child is a victim by an adult. Sexual abuse is contact without consent. And so when we talk about boys or girls, one of the things I always remind people is that children do not consent because they often do what adults tell them to do. So here are different types of sexual abuse. And I think it's really important for people to know, because a lot of people don't realize that even touching outside of the clothes is sexual abuse. Excuse me. Even sexualized talk is considered sexual abuse. Showing the child pornographic material or making them available is a form of sexual abuse. One of the things that I also do as part of my training in talking about sexual abuse against men and boys is that there was many things that happened to me as a child that I didn't know that was considered sexual abuse until I went on my own healing journey. And one of them that I remember, I grew up in a very dysfunctional home before I became a ward of the court at the age of 10 years old, and then went into foster care. But there was many things that I seen before I left the home. My family suffered with a lot of alcoholism. There was many different forms of abuse that was happening within the home. Mental abuse, my own sexual abuse by relatives, but also the piece that really blew me away when I was on my healing journey was the fact that what I seen happening to adults in my life where men were often having sex with women relatives who were passed out. That is also a form of sexual abuse, but it's also rape upon that woman. And so a lot of people don't understand that or know that. And it's important to know that boys are more reluctant to disclose than girls. Children who are a victim of a family perpetrator often delay disclosure longer than a non-family member. We always often ask that question because often sometimes too when sexual abuse is happening in the home, often the perpetrator will often threaten the one who's being abused. As for me, I was threatened by one of my main perpetrators and was told not to discuss what happened or I would get hurt. But I'm going to go further into that in the slides coming up. A child is affected by sexual abuse when he may question his ability to defend himself. He may question his body and say, what did I do to invite this? He may begin to hate his body. He may begin not to respect his body, and the surroundings around him often will begin to use alcohol, drugs, over under eating and smoking as a teen. A child is affected by sexual abuse when he disassociates. Even after the abuse stops, the child may feel he is ineffective, powerless, or worthless. He will often continue to question himself, why did this happen? Why didn't anyone stop it? Why didn't I tell someone? And often why young boys who are impacted by sexual violence of all forms, why they don't tell, again, is that threat by the individual who is doing the perpetrating on that young person will often not tell because of, again, I'm going to go even more in detail when we talk about the mental health issues. A child is affected by sexual abuse when he faces confusion and isolation when he is sexually abused by a woman. Often what will happen is that when a boy goes to an adult, and if it's a male, and discloses that he was, sexually abused by a woman, and often may not understand it either, often what happens is that the adult will trivialize it, praise him for what has happened to him, and this young boy may not realize that he was sexually abused by a woman, as an example. And if any other experience felt good, he was not abused. If he did not enjoy it, if he did enjoy it, he must have been homosexual. Excuse the typo on that. And that's one of the issues that really impacts even boys and adult males talking about sexual abuse or any other form of sexual violence that may have happened to them. It's often we have that huge stigma in regards to believing, or there's conversation that individual who's impacted, who's a boy who is a victim of a male, he must be gay because that happened to him. I can't tell you how many times I've heard that, which is, is not true. What I always say too is that a reason why a person abuses an individual or a child, it's all about power and control. That's the thing that we need to remember. And there has been studies that have been done that heterosexual males have often had high rates of being the perpetrators. And again, it was not about the sex, it was about power and control. So it's really important also to understand what pieces of childhood does a sexually abused child lose. We talk about loss of memory of childhood. Because of the sexual abuse that I experienced and a lot of the other forms of trauma that I experienced as a child, there's a lot of things that I don't remember about my childhood. There's very few good moments in my life. that I still have, and often I think about my grandmother, who was a good person in my life. So I really hold on to a lot of the memories that I have with her and the times that I shared with her. Lots of opportunity to play. Often we don't know how to, especially when you come from a home that's very dysfunctional, you don't get the opportunity to be a child, so you don't know how to play. Loss of healthy social contact, loss of opportunity to learn, loss of control of one's body, loss of normal, loving, nurturing environment. And there's other losses. But a lot of these losses that I experienced, I really had to work through and heal from it, and get to the place where I'm at in discussing sexual violence against men and boys. Because again, I say that it is a silent epidemic. I believe that there is more individuals who are impacted that you think about the unreported sexual violence of men and boys. The losses that boys and men experience in their early years leave lifelong scars and pain. Boys who do not fit the traditional macho image are marginalized, ostracized, harassed, and physically punished. Bullying results in trauma. The trauma that males experience is lethal, large, and hard to work through. It is possible, and that's one of the things that I really stress about boys and men who have to work through physical or sexual trauma, that it can be worked through. Many men who have hurt others may have been hurt themselves. Here are some facts, and I'm not going to go through all of them, but 75 to 95% of offenders are known and may be related to the child. One of the things that I know that we don't talk about in community, or even just having that conversation about, is the impact of sexual violence, the actual act that's being done. And I believe this is one of the reasons why we don't talk about it, because when we talk about human development and what happens when a child or an adult male who is being raped, what happens to the body, you know, often what will happen is the individual will have an erection and sometimes will ejaculate through the rape. And so what that causes is just more confusion on an individual, because when those things happen, we instantly think, well, I must have enjoyed it because this is what happened. So which also prevents them from talking about it. And so, you know, we need to, you know, create a space so that these individuals can talk about what's happening to them or what has happened to their bodies. A portion of abused boys go on to abuse children, which is true. It can possibly happen. But one of the things that I always acknowledge also when I'm talking about my own story in presentations is that I did not sexually perpetrate on individuals or boys or men, but I abused in other ways, maybe by verbally abusing my partners, or just lashing out at people around me. That was the abuse that I perpetrated on other people. As adult males, the impact of child sexual abuse. So I'm going to begin to talk about males, grown men. This research was done by the National Intimate Partner Sexual Violence Survey. It came out in 2010, and this is the only national study that included Native men. And in this research findings, it states that 1 in 4 American, Indian, Alaska Native men have experienced sexual violence in their lifetime. More than 1 in 10 have experienced sexual violence with penetration. Overall, more than 475,000 American, Indian, and Alaska Native men have experienced sexual violence in their lifetime. Professionally and personally, I believe that those statistics are much more higher, because we need to think about all the unreported. One of the things that I can tell you is that last year when I went and did this presentation down in New Mexico, I presented in front of 180 people, And what I found really interesting was that the 4 men who approached me did not approach me until the next day, right before I was going to do another presentation. But what I found interesting and very sad was the fact that these 4 men disclosed to me that they were sexually abused. One of them went as far as disclosing to me that he had been sexually abused by his mother for 15 years. One of the things that I still carry today when I talk about this topic is that I remember the looks on their faces when they disclosed to me. It was that face of relief that someone was finally talking about it. So that has been a really life-changing experience for me, knowing how difficult it is for men and boys to talk about the sexual violence that they may have experienced. Why do men wait to seek professional help? The abuse could still be too fresh. It may not have been defined as abuse. The perpetrator may still got you to keep silence, fear. The time and place may not be right to disclose. The individual may not know he has options, feelings of being weak or battered, self-blame, and also shame. One of the things also, too, that has really sort of impacted me in regards to sexual violence was at another time when I was doing a training for an organization with their board members and their employees and talking about sexual violence. One of the husbands actually attended the event with his wife. And one of the things that I remember when talking with him, he did disclose during the presentation that he was sexually violated by a spiritual person within his Native community. One of the things that I remember were how teary-eyed he became, but what he also talked about was that every time he would see this individual in community, his rage level would raise to the top of his neck. And so I just continued to let him talk. When he was done, I responded by saying to him, I'm really happy that you didn't act on your rage. And my hope is that you will find someone who you can feel safe and comfortable with to work through your child sexual abuse. But I think, you know, the most important part was allowing him to say what he needed to say, but also to acknowledge what happened to him and to validate his feelings. Those were some of the most important things that I can do for individuals who disclose to me about their sexual abuse. You know, and when you think about colonization and the boarding school era, just think about all the young boys who were in boarding school who were sexually abused by priests and nuns. You know, this is an intergenerational trauma experience where it's passed down from generation to generation. I've worked with individuals who identify as Two-Spirit or Native LGBTQ who have all disclosed, a majority, a high percentage of the individuals I've worked with, and people that I know in community who identify, who have talked about their experience of sexual trauma as a child and even as an adult. And I do want to stress that it's not true that every person who identifies as Two-Spirit or LGBTQ have experienced sexual abuse. So I really want to be clear about that. So men who are violent are often sent the messages as a child. Be strong, be sexually active, be straight, don't ask for help, don't cry or show vulnerability, take control and be dominant. So there's a question that I need to address. It's coming from Barbara. Is it possible that a young child, kindergarten age, can learn sexual information from video games? For instance, Grand Theft Auto? Yes, I do believe that can happen. Because one of the things that I always say to people, too, is that what we don't say enough is that what is said or seen by a child, they will repeat. So if a child is around this stuff in regards to sexual violence, they learn from that. And if it's not corrected, then they will grow up thinking that it's okay to do those things. So yes, to your question, that does happen. So a lot of these, what I'm talking about is that men who are violent are often sent a message as a child. These are a lot of things that I have heard Native men talk about in regards to this is what they're taught. You know, and when we're taught to be masculine, when we're taught to not to cry, and when things happen to us, what usually happens? I mean, we hold in all those feelings, and we can't always hold those feelings in because they come out in so many different ways. I mean, we may lash out at people, we may hurt people, we may do things that we normally don't do. The creation of domestic violence, sexual violence on women and men, those are the things. But like I said earlier too, I mean, we learn what we see and hear as children. And one of the things that I did that I needed to address was verbally abusing my partner because I was verbally abused. I mean, and I didn't know that I was doing that until this book flew out at me in Barnes & Noble, and it was called The Verbally Abusive Relationship. And I opened it up and looked at the characteristics, and my first thought was, oh my God, I'm doing this to my partner. So again, you know, I went through 10 years of extensive therapy to get through my own trauma, but I went back into therapy to address why I was doing this to him. And I periodically will do check-ins. I believe strongly that, you know, that I, for myself, need to do check-ins, but I also do a lot of my work through working with elders and sitting with elders and talking with elders. I always say that the Western way of thinking had its purpose. It helped me heal, but to further my own healing, I am connected to culture and spirituality. Here are some of the frequent issues and problems faced by adult survivors of child sexual abuse. Anxiety and confusion, depression, low self-esteem, shame and guilt, inability to trust themselves or others, fear of feelings, a need to control feelings and behaviors, compulsive caretaking, nightmares and flashbacks, insomnia, amnesia, violence or fear of violence, discomfort with being touched, compulsive sexual activity, and sexual dysfunction. So for myself as a two-spirit male, I've experienced almost every one of them. Also, it was hard for me to allow someone to get close to me or to even touch me. Like, for instance, my partner would often want to cuddle with me, and after a minute, I would say to him, okay, I'm done. Or we would be driving in the car, and I'd be driving, or I'd be sitting in the passenger seat, and he would put his hand on my knee just to show me affection, and I would instantly push his hand away. I didn't know that I was doing those things to him until he told me and asked me why I did that. So again, I went back into therapy. And one of the things that I learned from therapy, you know, it's kind of funny because we often think, you know, we're the professionals, you know, mental health providers, and we should know these things. And that was my first response to my therapist when I said that to her. Well, I should have known this. And one of the things that she reminded me of is, well, you know, Lenny, when you're in it, you don't know. But So what I needed to do was I needed to go back to him and let him know what happened to me, but also to remind him that it isn't about him, it's about me. And I also needed to let him know that for a while, I needed him to ask for permission to do those things because I had my rights taken away as a child. And so through the healing process, I was reclaiming my own body. So that's something to think about. Here are some more issues that are faced by survivors of child sexual abuse. And again, I'm not going to go through all of them. One of them that goes back to what I said earlier is that inability to sustain intimacy in relationships. I did, before I went on my healing journey, sought out abusive relationships because that's what I was used to. That's what I grew up with. And so I always sought out men who were violent in many different ways. One of the things I also talk about is that the sex addiction piece. I had my foot in the door of becoming sexually addicted. As part of my story, I come from the reservation, and I've been currently living here in Minneapolis, Minnesota for a little over 20 years now. And growing up on a reservation, a lot of these things I didn't know of. I wasn't connected to the LGBTQ community, and so when I moved to the cities, and I found out that you can get on the gay websites and hook up with individuals and have sex with them. During my time before I went on the journey of healing, one of the things that I was doing was I was hooking up with men 3 to 5 times a day. And it wasn't about the sex, it was wanting to be loved. And that was my way of thinking that's how I could be loved, by giving away my body. So imagine how much of the sexual trauma that I had to work through and to rethink in doing something healthy rather than giving away my body in a good, in a bad way. So it is very difficult at times to work through sexual trauma. I mean, there's a lot of things that you have to face. I mean, I can tell you the nightmares I had when working through all of the many different forms of trauma I experienced, but it was learning how to do things different. I experienced some compulsive behaviors. At one time, I had a very negative image of my body, where what I would do is I wouldn't wear tight clothes. I would wear baggy clothes because I felt like if I wore tight clothes, people would victimize me. Men would victimize me, and so I never wore tight clothes. So, these are some of the issues that really impacts individuals who are impacted, boys and men who are impacted by sexual violence. Here are 3 of the most common mental health disorders that boys and men experience due to sexual violence. Dysthymia, major depression, post-traumatic stress disorder. These are really heavy mental health disorders. But one of the things, too, that often we don't talk about when it comes to sexual violence is the disassociation. I can tell you many times that when violence was happening to me in all different forms, verbal, sexual, physical, often what I did was I disconnected. And it wasn't until recently where I had to have a really hardcore conversation with a psychologist, because I believed, and I do still believe, that I had my foot in the door of DID. I do not believe that that I'm diagnosed as DID, but I believe that I had my foot in the door of developing DID because I had some of the characteristics of a person who may be diagnosed as DID. So how do we help men and boys heal? First of all, I believe that we need to create a safe place for that individual to tell their story. And when I mean creating a safe place, we need to show compassion for that individual and to have empathy and to listen to them. Breaking down that stigma, we need to educate and bring awareness, encourage and support to discuss. One of the things that I know in all the research that I've done in regards to sexual violence against men and boys is that here in the United States, there is a very little research that's being done. There has been a lot of research that's been done in other countries in regards to sexual violence against men and boys, but I know that there's very little research. What I also know, too, is that there's very little services to help men and boys to work through sexual trauma or even domestic violence. What I also know is that we're 20 years behind in providing the proper services for boys and men. You know, I believe it's important that we begin to have these conversations so that we can begin to have the creation of support services for men and boys. One of the things that I also know of, too, is that 10 years ago when I was going through my training as a mental health provider, what thought that keeps coming to my mind is always remembering that if we're not okay about talking about sexual violence when we're meeting with individuals, then we're not going to get to the core of the issue that may be impacting that individual. So we got to be comfortable with talking or asking the questions, were you sexually abused? What I believe is also important too is just, you know, for me, as I began to talk with individuals or work with individuals who have experienced sexual violence, is learning just to listen to them and try not to solve the problem. What I find really interesting too is that here in Minnesota, I was invited to present on this topic at a men's summit. And one of the things that I told the organizers is that I don't think that we're going to get a lot of people who will attend my session. And the organizer said, why? I said, because it's not a topic that we talk about in Native community. And sure enough, there was 170 people that were registered for this Native American Men's Summit. I had 5 men attend and 1 female. What I remember about the presentation was that every time I would look towards the door, there would be men looking in, and then they would walk away, or they would walk by and look in. And the second time, just recently in April, I was asked to present again at one of their conferences on this topic. And there must have been about 40 people who attended the session. What I found really interesting was there was 2 males who were Native and 1 white male that attended the session, and the rest were all women. What I found really also interesting was that one of the Native males walked out and never returned. So if you think about how uncomfortable it is to even have these conversations about sexual violence against men and boys, and how difficult it is for even adult men to talk about it. But we know, I mean, I know from my conversations with individuals that there is a lot of men out there, adult men, who are impacted by sexual violence and have not even begun to work on it. So again, how do we help men and boys heal? We change the way we talk and think about individuals who experience child sexual abuse. Not all victims of child sexual abuse become abusers. One of the things that has been part of my healing is the sweat lodge. I talk about a Two-Spirit Dakota woman who took me into my first sweat lodge, support groups, talking with elders. That's one of the things that I continuously do even today, is just going and sitting with elders and getting their thoughts, because I strongly believe that we do have elders who carry a lot of knowledge in helping us heal. So I've used elders in many different ways. I mean, even through the grief process of losing one of my sisters. When I lost my sister, some childhood trauma stuff resurfaced, and so when I returned to Minnesota from South Dakota, I went directly to a grief and loss group, which I feel is another issue that we're not doing very well in our Native communities, because I wanted to seek out a Native grief and loss group, and there was none here in Minneapolis. So I went to a group and was the only brown person in a room full of non-Native people. But my thought was that if they began to start using the Bible, because the event was held at a church, I knew right away that I was going to walk out. But it ended up being a great support for me for a couple months. But then I also did go into therapy to see a therapist, and I let that therapist know I worked through some of my childhood trauma, or most of it. I do not want to revisit my childhood trauma, but I need to understand why this happened. Why did this stuff resurface, this childhood stuff? What I know of is that when my sister, when she passed away, she never had the strength or courage to take a look at her own trauma, you know, because she was a part of we all experienced some childhood trauma. And so that was really impactful for me. But I also, what I did was I would see the therapist once a week for a month, and then I would also connect with an elder. So I got two of the, I would say, best of both worlds, because I was getting the Western perspective, and I was also getting the elder perspective on my grief. So for me, that was really helpful in the work that I was doing. So I don't know, I know in my heart that this is a topic that we don't talk enough about, and I know that this is a very impacting topic that is really, really plaguing our Native community. I couldn't give you a number, but again, going back to the statistics that I showed earlier, I believe that they're much more higher, especially with my own experience in talking to individuals. I'm not sure if there's any places within your community that would allow or even create a safe space for men and boys to talk about their sexual violence. But what I know of is that in several studies, they stated that we are 20 years behind in providing services to male victims of sexual violence, and there is a lack of research and data. Again, all of the research and data is from different countries. You can't find a lot of journal articles in regards to sexual violence against men and boys. There is not a lot of Native men who are even reaching out in tribal communities and having presentations or even talking about it publicly. I'm not saying that we should never force a person who experienced sexual violence to come forward with their story. And the reason why I do it is because, it did a number on me. I also believe that individuals can heal from their sexual violence, and also my work that I do in the Two-Spirit Native LGBTQ community, because like I said earlier, almost every individual that I've talked to, both male and female and transgender, have all reported being sexually violated as a child and even as an adult. This goes back to one of the focus groups that I did with an organization here in Minneapolis, and one of the things that they wanted to do was to find out how much violence and sexual violence was happening in the Two-Spirit Native LGBTQ community. And so they asked me to organize a group of individuals who would be willing to come and be a part of this focus group. So we had 15 individuals, both male and female, and transgender individuals. And one of the things that I found very astonishing was that 14 out of the 15 individuals in the room reported being sexually abused as a child or raped as an adult, and did not report it. So we know that this is happening in all of our communities. No community is not have experienced that. So as we begin to wrap up our my presentation, one of the things that I want to remind everyone that it's important to know that not all issues and problems are the same with all adult survivors of child sexual abuse. Each individual is different with similarities. That's one of the most important pieces because, again, I don't want to put labels on individuals, and I think it's important that we don't do that. Let me quickly look at this question that's being asked. Can you speak on, or are there resources that explore sexual abuse on men and boys who are hetero? No, there isn't any resources. One of the things, too, that I really want people to understand, too, is that the reason why I do this work, too, is I want to take away that stigma that not only men and boys who identify as LGBTQ or Two-Spirit are impacted by sexual abuse. Heterosexual men also experience sexual abuse. So I want to take that labeling away. And so that's why I say I am a male. I was sexually violated. My identity as a Two-Spirit person has nothing to do with why I was sexually violated as a child and even as an adult. There is not a lot of resources out there. I'm going to be giving some books that help me along with my research. And also, too, if any of you are familiar with PBS Frontline came out several months back on a documentary on Predator on the Reservation. And what this documentary was about was the Indian Health Service had a doctor who was located in Montana. And what had happened was he was molesting boys on the reservation. And the issue was that IHS knew of it, and they moved him to another hospital in South Dakota. He has been sentenced in Montana. I believe he's currently right now going through the court proceedings. But what I found really astonishing about that documentary, I did get angry in the middle of it. I had to stop it because it just upset me that the Indian Health Service knew of this. And what I found really interesting, too, was that they do not know exactly how many boys that he molested, and also that one of the people who testified against him, one of the males who testified against him, was in prison. They gave him this image of being a really buff male with a lot of tattoos, very mean-looking, and when he was on the stand testifying against this doctor, the people who were there viewed this adult male as being a little boy. So also remember, too, that when we experience trauma, and it's repeated trauma, our development stops. So I felt really sad when I heard that part in the documentary about this adult male who looked like a little boy. So I could only imagine what he was feeling and what he was experiencing. So I would really encourage all of you, if you get the opportunity, the link to that documentary is on the resources. This is some of the information, some of the books that I've read. I've read every one of these books in regards to sexual violence against men and boys. So I really encourage you that if you would like to learn more, if you'd like to educate yourself more, please take the time to read these books. And again, you will not find a lot of articles, journal articles in regards to sexual violence against men and boys because there's just not a lot of research that's happening here in the United States. A lot of the research has been outside of the United States. So I hope that was helpful. Before we end, we got about 10 more minutes. Is there any other questions that you may want to ask? Again, 55 minutes is not enough time to even begin to break into conversation, but this was more of educating and bringing awareness of sexual violence against men and boys. Here's another question by Barbara. What are your thoughts on having where in male sports young men will show gay porn to teammates and push to look at it to see if they have a response? Well, that is a form of sexual violence because you should never, ever force someone to do something that they're not comfortable with. But I know that happens. I strongly believe that's a form of sexual violence. And we know also hazing happens too, where often sometimes there's a sexual part of that hazing that happens that is a form of sexual violence. Someone's typing a question. My information is on the PowerPoint presentation. If you want to contact me, my email address is tatetopaconsulting@gmail.com, and I also do have a website, www.tatetopa.com. Wanda asks, is there a book from this list that you would recommend for a young man just beginning to share his experience and begin therapy? He's a young 20-year-old. Let me see. Well, most of these books are really clinical, so I would not recommend this young boy or this young 20-year-old to read any of these books because the majority of them are clinical. So one of them that I would recommend is The Father's Touch. But that book also too uses the church, Christianity, and he tells his story of healing through the church and all of that. That may be a good book to read, but I would not recommend this 20-year-old reading any of these books because, like I said, there are a lot of them are really clinical, and I would not want that 20-year-old to re-traumatize himself. I would just say, create a safe space so he can begin to talk about his sexual trauma. It's just way too hard to even. I'm just fearful that if he reads any of these books, that he may get re-traumatized. Jim, a good book for parental convert sexual abuse is Silently Seduced by Dr. Kenneth Adams. Oh, well, I need to write that down. Thank you, Jim. We have another question coming up. Are there any stats that on the percentage of sexually abused males who are substance abuse when adult? Oh yeah. I mean, going back to the slide, the previous slide, I am not sure if there's a lot of statistics on that, but just imagine those two slides that I had talked about, the issues that impacts a majority of individuals, and I do strongly believe that as a clinician, that individuals who have not worked through any form of trauma that they may experience can lead to addiction issues. Just think about, you know, what I said earlier too. I mean, I had my foot in the door of being becoming a sex addict. I had my foot in the door of, I do not call myself an alcoholic, but I call myself a person who abused alcohol, because when I chose to stop using, I didn't go through a program. I mean, I didn't have any difficulties in stopping. I went, you know, really went into the sweat lodge to help me further heal. So sexual violence of all forms and all forms of violence or trauma leads to addiction issues if they're not worked through.
Well,
Well, we just have a few more.
sorry, Lenny. I was just going to jump in and say we have a few more minutes if people still have questions. But while we're waiting for any questions, I just want to start off by saying thank you so much, Lenny, for sharing, for being so open about your experience, and to give us a jumping off point for helping those around us talk more about this issue and to care for those that we encounter who have dealt with this as well. So thank you so much, and um, yeah, I appreciate all the questions and the interaction that we've had from everybody who's joined us. So I want to thank you too. Um, yeah, before we finish up, it looks like we're getting a lot of positive comments in, and so yes, I want to point out that the PowerPoint, we have handouts available. If you look in the files pod, just underneath the presentation, there is a little pod where you can download the handouts and as well as the CEU request form. They're both there. But we will also be sending an email to everyone who attended that will include the handouts as well as a link to the recording, so you can view this again. You can share it with colleagues. So that's something you can look for within the next couple of days. Um, yeah, and again, Lenny, just we so appreciate your knowledge and expertise in this area, and I want to ask you if there's anything else that you wanted to say before we finish up.
No, but again, if you all have any questions or concerns, please give me send me an email. All my information is attached to the PowerPoint presentation. I am looking in helping as many people as I can on a topic that we do not talk about. So, thank you.
Wonderful. Thank you so much, Lenny, and thank you to everyone who joined us. And with that, I'll close this out, and we hope you join us next time.